Today we will start about phospholipid. What is lipid? Can anyone tell what is lipid? Lipid is heterogeneous compound with biomedical importance containing many groups, and it is insoluble in water and soluble in polar solution. It's like chloroform, ether, okay, non-polar solution like chloroform and ether. So, here classification: simple lipid, complex lipid and derived lipid. Simple lipid, in that it is fat, oil and wax is present. Okay, what is simple lipid? Simple lipid is ester, like fatty acid and one alcohol. Okay, fat is ester, fatty acid and alcohol. Oil is ester, present in room temperature, which is liquid. Okay, and wax is high molecular weight fatty acid with high molecular weight monohydric alcohol. Okay, and in complex lipid there is phospholipid, glycerophospholipid and sphingophospholipid. Glycerophospholipid here is alcohol, it is also ester, lipid is present, glycerol is present, so glycerophospholipid with containing some other other groups like nitrogen containing groups or other groups. And sphingophospholipid, here is ester also, but here is sphingosine is the alcohol, and in lipid containing sphingosine alcohol. Okay, and glycolipid, here is, it's also called glycosphingolipid, here is no phosphoric acid residue. And other complex lipid, there will be sulfate group, so sulfolipid, amino group with lipid, aminolipid, lipoprotein with protein and lipid together, lipoprotein. And derived lipid, like fatty acid, glycerol, steroid, sterol, cholesterol, other alcohol, fatty aldehyde, ketone bodies, hydrocarbons, lipid soluble vitamins and micronutrients and hormones. Okay. So, function of phospholipid. Phospholipid, what is it has? It has a phosphoric acid residue with fatty acid and alcohol is glycerol, and nitrogen containing compound is there, and other compound also can be attached. So, phospholipid. Okay. Phospholipid is main lipid constituent of membrane. Phosphatidylcholine is lecithin. Where we see lecithin is dipalmitylphosphatidylcholine, DPPC, or DPL, dipalmityllecithin, present in, say, surfactant. Okay. So what happens in lungs? There is where there is more surface tension, so they will be attached together, and so they will not inflate. And in lungs, what happens? You have to inflate, so the gaseous exchange can happen. And for inflation, because the small alveoli is smaller in size, they're like spherical, and there's too much surface tension, their probability to go for collapse. So surface tension, what happens? They decrease the surface, surface active reagent. Surfactant is surface active reagent. It decrease the too much affinity together, they can't stay together like this, so they will be inflated at the end exhalation, so they can be gaseous exchange. Okay, and surfactant is needed, and for the surfactant to work, there is contribution factor is water vapor, and another is surface tension. Okay. So lecithin is present in dipalmityllecithin, present in surfactant, and sphingomyelin also present in cell membrane. Sphingomyelin we can see in the myelin sheath also. So, sphingomyelin and phosphatidylcholine are abundant in cell membrane. So, cell membrane has different functions, so they will be also helping in that. Phosphatidylethanolamine or cephalin. Phosphatidylserine also found in cell membrane. Here you have to remember phosphatidylserine plays role in apoptosis or programmed cell death. Okay. So, phosphatidylserine plays role in apoptosis. Sphingomyelin present in lipid rafts. What is lipid rafts? Their specified structure present in outer leaflet of lipid bilayer. Okay, there sphingomyelin is present, and sphingomyelin mainly large quantities, they are present in large quantities in myelin sheath, helps in cell signaling and also apoptosis. Apoptosis means programmed cell death. So, phosphatidylserine and sphingomyelin both helps in apoptosis. Phosphatidyllinositol is a precursor of second messenger. This is also present in cell membrane. It helps in cell signaling, membrane trafficking, and phosphatidyllinositol 4,5-bisphosphate, that is PIP2, gives rise to two form of product, that is DAG, diacylglycerol, and inositol triphosphate, IP3. Phosphatidylglycerol gives to cardiolipin. Phosphatidylglycerol, it will form diphosphatidylglycerol and it will form that cardiolipin, which is a major lipid in the internal membrane of the mitochondria, and it helps, if it is a problematic cardiolipin, so it gives rise to heart failure, cancer and birth syndrome. Lysophospholipid. So, phospholipid, if you break down by phospholipase A2, so it will form lysophospholipid. They are intermediate in metabolism of phosphoglycerol, found in oxidized lipoprotein and promote atherosclerosis. Lysophospholipid can cause atherosclerosis found in oxidized lipoprotein, lysophospholipid. Plasmalogen found in brain and heart. This is present in the membrane. This helps in cell signaling and endogenous it is the endogenous antioxidant. Amphipathic lipid forms. Amphipathic lipid are phospholipid and sphingolipid. They are present in membrane. Amphipathic lipid helps in micelle formation, water in oil emulsion, liposome formation. That is, liposome is unilamellar or bilamellar, means single lipid bilayer or multiple lipid bilayer, and that size from 0.025 to 2.5 micron. In liposome, we can deliver sucrosomial iron, oral iron in liposome, we can deliver as sucrosomial iron. In liposome, different phase is there, aqueous phase and polar phase and non-polar phase. There we can delivery drug, gene, protein, and it helps in chemotherapy, gene therapy, cancer therapy, vaccination. Clinical importance, respiratory distress syndrome. This happens when the surfactant is reduced. So, DPPC, dipalmitoyl phosphatidylcholine, or DPL, dipalmitoyl lecithin, when it is reduced or absent, that is a respiratory distress syndrome happen. ARDS happens in 1 year of life when there is infection, inflammation with reduction of surfactant. ARDS in 1 year of life when there is infection, inflammation and reduced surfactant, and so the gaseous exchange can happen, pulmonary edema can occur. So, there is ARDS. Meconium aspiration. What happens for baby? that fluid goes from airway to the amniotic fluid, but during aspiration they when they gasp, they start gasping, then that meconium cause the damage of the alveolar lining and causing decreased surfactant will be reduced, so there will be damage. Then pulmonary alveolar proteinosis, there also metabolism of surfactant will be reduced. Neonatal hyaline membrane disease or respiratory distress syndrome of newborn. This happens in newborn when there will be hyaline membrane. Hyaline membrane will be formed due to fibrin clot, blood cell, neutrophil, macrophage, everything together will form the hyaline membrane. With reduced surfactant production, there will be respiratory distress syndrome for newborn. Fetal lung maturity. Fetal lung maturity, we see L by S ratio, lecithin by sphingomyelin ratio. If it's less than 2:1, that means there is reduced surfactant production. And if it's phosphatidylglycerol, so means if it's enough phosphatidylglycerol, means lung maturity is enough. So lung maturity has happened. For the surfactant to be produced, we need thyroxine. Thyroxine will cause the surfactant production, and for lung maturity we give glucocorticoid from outside. If the baby doesn't have the premature baby, we give glucocorticoid. Here sphingolipidosis. Here is sphingolipid. Here the lipid containing sphingosine. Alcohol is sphingosine. Alcohol is sphingosine. Here different enzyme deficiency is there, lipid will be accumulating and there will be symptoms. So diseases are like Tay-Sachs disease, Fabry's disease, metachromic leukodystrophy, Krabbe's disease, Gaucher disease, Niemann-Pick disease and Faber disease. In Tay-Sachs disease, it is hexosaminidase A and S. Lipid accumulating is ganglioside. If you write, that is will be also enough, but if you write GM2 ganglioside, that will be good. Clinical symptom, mental retardation, blindness, muscular weakness. Fabry's disease is due to alpha galactosidase. It is lipid accumulating globotriacyl ceramide. Their clinical symptom will be skin rash, kidney failure, full symptoms in males will be seen, and it is X-linked recessive. Metachromatic will be, it will be metachromatic leukodystrophy will be there, metachromatic leukodystrophy. Aryl sulfatase A deficiency will be there. 3-sulfo-galactosyl ceramide accumulation will be there, and clinical symptom will be mental retardation, psychological disturbances, demyelination. In Krabbe's disease, beta-galactosidase deficiency will be there, galactosyl ceramide will be accumulating, here will be mental retardation, myelin will be absent, almost absent. Gaucher disease, beta-glucosidase enzyme deficiency will be there, lipid accumulation will be glucosyl ceramide, and clinical symptom, it will be enlarged liver, spleen, mental retardation, fatal in early life. Niemann-Pick disease will be A and B type. Here enzyme deficiency is sphingomyelinase, lipid accumulating choline sphingomyelin. Clinical symptom will be enlarged liver, spleen, mental retardation, fatal in early life. Faber disease will be causing due to ceramidase deficiency, lipid accumulation will be sphingosine ceramide, clinical symptom will be mental retardation, enlarged liver, spleen, fatal in early life, hoarseness, dermatitis, skeletal deformities. Here what happens, that lipid production is fine, but lipid sphingosine metabolism will be defective. So, and here that enzymes are lysosomal enzyme defect. It is inheritary and they are mostly hydrolases. You will write mostly hydrolases, that the enzyme. Okay. Metachromatic leukodystrophy, myelin sheath, there will be accumulation, so there will be myelin sheath broken down, there will be no nerve conduction. This is Gaucher. In Gaucher disease, there is Gaucher cell. This is Niemann-Pick disease. Here also lipid will be accumulating inside the macrophage to produce the foam cell.